How to get rid of your cough. Stay tuned to find out. What's up guys, and welcome back to the channel. For those of you who don't know, my name is Edgeman and I'm currently a 4th year pharmacy student, and I enjoy making these videos about common questions patients have about medications or any health related topics, so make sure to subscribe for more content. Now to the rest of the video. A cough is a very annoying symptom to have whenever you're sick, but there are ways to treat it, both with over-the-counter medications and prescription medications. But in this video, I'm only going to be talking about over-the-counter medications because it's much easier to access compared to prescription medications, because you have to go see a healthcare provider to get assessed and then they have to write the prescription. Just to make this video more concise, we're only going to be talking about the over-the-counter medications. Now before we talk about the different treatments for your cough, let's first figure out what type of cough you have. Now there's typically two different types of cough. There's a productive or wet cough, which is whenever mucus is coming out when you're coughing, and there's a dry cough, which is no mucus is coming because it's dry. Now the treatments for these are a little different. For the wet or productive cough, you want to generally treat it with Mucinex or guaifenesin. That's a generic name. The way this medication works is that it loosens the mucus in your lungs, and it kind of helps you cough out more of the mucus to help decrease the mucus in your lungs, which will generally help you breathe a little better. Whereas the other medication for dry cough, the generic name is dextromethorphan. The common brand name is Robitussin. So the way this medication works is that it basically tells that part of your brain that's telling you to cough to not tell your body to cough. And I know that was a very simple way of explaining the mechanism of action for dextromethorphan, but if you guys are interested in a more detailed way of how it works, I'll put a link in the description below. For those of you guys who are still watching, you guys now know what type of cough you have and what type of medication that could help treat that cough, whether it's a dry cough or a wet cough. Now before you go down to the pharmacy and get the medication I recommended, I want to give you guys some insight about something. So with over-the-counter medications, there's so many different options, it might be overwhelming. So for example, you go to the cough and cold aisle, you see a bunch of different colors of different words of like cough and cold, fever, brand names, generic names. It gets overwhelming at times, and also different prices. Why is this one more expensive? Is it better or is it not better? So one thing I do, and I tell patients also that kind of makes this process much easier, is always look at the back of the packaging and look at the section that says active ingredients. The active ingredients section shows you what actual medication you're getting. So let me give you guys an example. So let's say you have a dry cough, right? You go down to a pharmacy and you said, okay, in this video I recommend dextromethorphan or Robitussin for the dry cough. Now you go down to the pharmacy and you look at the back of the ingredient of a generic, because typically generics are cheaper. You go look and it says, okay, yes, dextromethorphan. Okay, so that's good and the price is good. But there's another one has dextromethorphan and acetaminophen, which is Tylenol, and it's like $2 extra. This one, and it says cough and cold, has better packaging, better words on there in terms of making me want to get this one. Should I get this one? Now the question I want to ask you is, do you know what you're getting in terms of the extra medication? So for the example I talked about having Tylenol or acetaminophen as the extra ingredient, right? Acetaminophen is generally used to treat a fever. Now, do you have a fever? If yes, then that's great. You're getting 2 medications in 1 tablet typically, and it's going to help you manage your symptoms. But let's say you only have the cough. Do you actually need that acetaminophen? Probably not. Then you're paying extra for something that you don't need. And I don't think anyone likes to pay some extra for something they don't need. And that's the insight I'm going to give you guys. So to always look at the back of the label where it says active ingredients and look at what the medication you're getting. Because a lot of patients, when they come ask me for recommendations for over-the-counter, and sometimes they actually bring me they bring me 2 different packages. Like, which one should I get? And what I always do, I turn the package over and I look at the back and I look at the active ingredients. And I tell them, so this medication has these ingredients and it's going to help treat these symptoms. Do you have these symptoms? If yes, great. If not, let's try to find something else that doesn't have that extra ingredient or extra medication in there to help you save money, because those are typically cheaper. And I always try to be honest with my patients as well as honest to you guys watching this video. So that's just some food for thought I wanted to share with you guys. And always talk to a pharmacist or your doctor about adding medications or changing any medications. Those are my recommendations for over-the-counter ways to treat a cough, and also my little rant about picking medications over the counter. So I really hope you guys enjoyed this video. Please give me a big thumbs up and comment any questions you guys have for me or any feedback you guys have for me. I always read the comments. And make sure to subscribe to my channel if you guys enjoyed this video. I'm trying to get to 1,000 subscribers by May, so hopefully we get there. Thanks for watching. See you guys next time.